Okay, we are back with our base of tongue tumor. Now, our patient has undergone their diagnostic workup as well as their biopsy. This patient particularly has been diagnosed with what we call a P16 status. In this particular case, this patient was found to be P16 positive, and now they have had imaging completed, such as a PET scan, so it's going to help us with additional staging. So, when you look at this particular patient, we're going to give them a T4. Now, we're going to give them nodal disease of an N1, which means that the cancer has spread regionally. The cancer has spread to one side, 3 centimeters or smaller of the lymphatics. Now we are going to continue on with an M. Our particular patient is going to have an M0. This patient is going to go through a variety of treatment options with their team, including ear, nose, and throat surgery, including radiation oncology and oncology. Let's give our patient the decision. They've decided, okay, I've navigated with all of my doctors, all of my options, and I am going to proceed with what is considered to be definitive chemoradiation therapy. Now, traditionally, this patient is going to have 7 weeks of chemoradiation therapy in which they are going to go to radiation every day. The entire session is around 30 minutes, but really it's about 5 minutes to get in, 5 minutes to get out, 15 minutes in the mask. So 20 to 30 minutes is how long they're at the treatment session. And then they're going to receive chemotherapy. And chemotherapy is going to be typically 1 time a week with their oncologist. So we've created a paradigm because as speech pathologists, we have a hard time understanding, like, where's my patient at? What type of disease do they have? How is that disease going to impact that patient's overall outcomes? As a speech pathologist, you need to be asking yourself, where is the disease? How large is the disease? And what are the expected outcomes for this patient? You hopefully will be a part of a tumor board. If you are not, get involved. Next, in this paradigm, we are going to focus for a moment on treatment and what does it look like for our patients to come to us during the course of their treatment. We hope that your doctors have sent you the patient at the time of diagnosis so that you could have started what's called prehab. Prehab are education, okay? That's our goal. Education, exercises, and baseline evaluations. If this is your second visit with your patient, I love, if at all possible, to now begin to put my brain in the treatment bubble. And I'm going to stay focused on the treatment bubble. During the second visit with my patient, hopefully I am seeing them weeks 1 or 2 of their treatment. Hopefully my patients came to me at time of diagnosis. I was able to evaluate them, get them started on their exercises. Now it's been a few weeks, they have some questions, and now they're ideally in weeks 1 or 2. I love to schedule, I'll give you a heads up, I prefer week 2 here because they are going to have questions, and week 1 I have found is just so overwhelming. So I would like to see them for their second visit of speech pathology during week 2. Here's my goals. Number 1, how's their quality of life? That's the most important. Number 2, what questions do they have? And number 3, what's my role? So quality of life, patient questions, what's my role? My role clinically during the second visit for a base of tongue P16 positive patient is to identify what side effects are you experiencing, if any. So we start to navigate the side effects. Now entering week 2, we start to navigate their pain. Are they having any? We start to navigate, how's your swallow looking? How's your appetite? How's your nausea? We start to navigate again. How's the mouth opening? So I measure my mouth opening, measure MIO, and I refresh my patient because the first visit was so overwhelming because you're flooding them with information. I refresh my patient on the expected side effects. And so we start to navigate what each one of those side effects could potentially look like, combined with a timeline. Because we understand there's an expected timeline for our patients for their side effects. This is not a guessing game. It really is not. There is evidence-based practice with many specialties that have navigated the head and neck cancer world to be able to tell our patients what they can expect and how that can be helped. So we are in our treatment zones. We are expecting 1 to 7 weeks. This is our second visit with our patient. Here we have measured their MIO. We have measured additionally, if we can, get some neck measurements because we're going to be expecting soon a weight loss. It's just nature of the diagnosis. So if you can go ahead and identify starting weight and then that weight at the second visit, that will help you to keep in contact with the radiation oncologist on how they are actually doing with regards to keeping up their nutrition and hydration. They should also have a registered dietitian in their wheelhouse. And then next, we're going to kind of double check swallow function and see if there's anything being bothered in terms of needs for diet modification or other strategies to help continue to keep our patients chugging along in their treatment. This can be a beautiful place for you to also learn the caregivers and start to navigate what is the patient's support and what is going to be my role in the long term. Now, I want to give you a heads up. Mostly the second visit, you may be starting to see some tiny side effects, sometimes related to mucositis, depending on the week you get them in. If you get them in weeks 2 or 3, you might be seeing some tiny inflammation, some erythema, potentially some reports, if you're at the end of week 2, of xerostomia, dry mouth, nausea, fatigue. So you're really looking for each of these side effects and how are you going to help your patient in managing each of these side effects. So the key point, assess, evaluate, look for any changes, any mucosal changes, and then continue your pathway along the journey of taking photos for your patient so that they can see their progress as well.